going to talk about hospice. So what is hospice? So I'm going to give you an example. You went to the doctor. You had a biopsy done. You found out that you had cancer. The doctor starts, giving you chemo. He's giving you radiation. And despite all efforts, you are not achieving remission. So you sit down with the doctor and you see if there's anything else you could do. The doctor says he's giving you chemo, he's giving you radiation, and it seems to be getting worse instead of better. And in some cases, it's actually spread into other parts of the body. So at that point, he tells you, there's nothing else they can do, and he refers you to hospice care. And so that's where I step in. I'm a hospice nurse. I've been a hospice nurse for 12 years, and I do hospice admissions. So what happens is we send a marketer out, and the marketer, fills out consents and everything with you, the consents to treat, for the nurse to come out and things of that nature. Then after you sign the consents, the company notifies me of that, and it also sends me your hospital records, any hospitalizations you've had, the records for your oncologist and all of that. I go over those records before I get to you, and then I call you and make an appointment with you. After I make an appointment with you, I stop by, and there's several things that will take place during the admission. So first of all, I'm going to do a head-to-toe assessment on you, and it's just what it says. I'm going to check you from your head all the way down to your toe. Okay, what I'm looking for is abnormalities that may need to be reported to the doctor, or maybe need treatment. Okay, so once I see that and document all that, we're going to go over your medications. What type of medications are you taking at this time? If we need to add something, we'll add medications at this time. If you're willing to discontinue some of your medications, then we'll discontinue some of your medications at that time. But we are not there to just take all of your medications. We are there to provide comfort. So what is hospice? Hospice is comfort. Hospice is not healing, but it's to make sure that the patient remains comfortable while at home. Okay. So we're also going to talk about your health history. Even though I have the records, I want to hear your perspective of what you've been through. So we're going to go over your health history. We're going to go over any questions or concerns that you may have about hospice in general, or your general health. You may want to know, everything that comes along with that. So after that, after I've done an assessment on your body, and after we've talked about your medical history, at that point, I'm going to contact my physician, and I'm going to go over everything with the physician, and they're going to give me a yes or no on if you qualify for hospice. We're going to come up with a diagnosis based upon your health, and that is what we're going to use to qualify you for hospice. Okay? Hospice is when a doctor has deemed that you have 6 months or less, you have a terminal illness, and that is what we use to qualify you for hospice. Okay? Another thing is equipment. Do you need anything? Do you need oxygen? Do you need a hospital bed? Are you wearing diapers or pull-ups or stuff like that? Those are things that hospice provides. They also provide most of your medications. We go over your list, and really what hospice provides depends on your diagnosis. Okay? If hospice does not provide it under the Medicare benefit, then you would just keep paying for it under your Part D, which you've been doing before you join hospice. After that, we talked about the equipment. We're going to talk about supplies. Do you have wounds? If you have wounds, then we provide wound care supplies. If you wear diapers or pull-ups, we provide wipes, bed pads and all of that. We do not provide the sheets for the hospital bed. So you have to buy those yourself, in their twin size sheets. So after all of that, I explained to you, how often the nurse is coming. If you need a hospice aide, I explained to you how often the hospice aide is coming, and the social worker and the chaplain and all of that. Also, we will have a discussion about a do not resuscitate order. So what is that? Just what it says, do not resuscitate. So when you sign a do not resuscitate order, you're saying that you do not want CPR provided if you stop breathing, okay? And you do not want any artificial means of resuscitation, mechanical vents, and things of that nature. That is what you're saying when you sign a DNR. If you do not sign a DNR, what's going to happen is the medical personnel is going to come in and they're going to do CPR. And you might end up with broken ribs from that, because they're going to do it pretty hard, okay, to try to get you breathing again. So that's what hospice is about. It's about comfort. We sent a comfort pack out. It usually has morphine in it for pain, lorazepam for anxiety. It has Biscadil in it for constipation, acetaminophen for fever, and it has Levocin, which is for secretions if you start to build secretions in your mouth. So that's what it's all about, comfort. We're not there to take all your meds and, just watch you die. Please don't let anybody tell you that. Hospice is about comfort, and we're going to make sure you're comfortable. I hope you enjoyed it. If you like this video, like, comment, and subscribe. Thanks for watching.